Hello, and thank you for visiting our poster. I'm Dana Corsi, Regional Rehab and ALC Lead with the Northeast Specialized Geriatric Center, and I'm honored to share our team's work on developing the standard of care for older adults living with or at risk of frailty, a framework for equity and excellence. This work really began with a shared question. How can we make sure that older adults living with or at risk of frailty experience the same, consistent, high-quality care no matter where they are accessing that care across the system, regardless of where they live? Over the next few minutes, I'll walk you through how this framework came to life, what it defines, how it aligns across provincial priorities, and why it can be used as a powerful foundation for care transformation. So why a standard of care? Older adults living with or at risk of frailty require a consistent, evidence-based approach to care that addresses their complex needs across the continuum. In Ontario, numerous provincial clinical guidelines have been developed to meet these needs, especially within the last 15 years. However, variability in implementation has constrained their overall impact. How do we know which one to use and when? How do they all go together? The purpose of our work was to synthesize these guidelines into a unified framework to enable equity-driven improvements in care delivery and outcomes for this population. In terms of how we built the framework, the standard of care for older adults living with and at risk of frailty was developed through a structured inductive process. We reviewed 22 provincial clinical guidelines, which you can see listed on the poster, to identify best practices across diverse objectives. Recurring themes were identified through pattern recognition, focusing on shared elements, processes, and domains. These findings were synthesized into a cohesive framework designed to standardize care delivery while allowing flexibility for context-specific adaptation. Stakeholder engagement and feedback validated the framework's relevance and benefit for implementation. As you move to the center of the poster, you can see our result, where the 22 provincial clinical guidelines became the standard of care for older adults living with or at risk of frailty, which is ultimately made up of core elements of care. So for example, older person and care partner engagement, interprofessional teams, specialized geriatric expertise, processes of care, which are made up of early identification, care planning, including advanced care planning and transitions, and finally, domains of care. So cognition, delirium, continence, function, sleep. The framework fosters consistency in care delivery by standardizing the core components of care that are required to reduce variability and promote equitable access. Why does this matter and what does this mean for us? The standard of care provides a replicable, equity-driven framework for advancing care for older adults living with or at risk of frailty. It provides the structure for aligning diverse guidelines, which you see on the poster, into a unified model, strengthening population-based infrastructure to address system priorities. This adaptability ensures effective, localized implementation while fostering equity and quality across systems. At its heart, this framework is about setting a clear and shared expectation for how we care for older adults, one that's grounded in evidence, equity, and compassion. By aligning our practices to the standard, we move closer to a system that truly supports recovery, independence, and dignity for every older adult in every setting. In terms of the work that we've done, we'd like to include a few acknowledgements, recognizing folks' contribution to this work. First and foremost, with gratitude to older adults and care partners whose experiences have grounded this work in real-world needs. This is all about people and their care, and we would not be here without them. Thank you as well to Provincial Geriatrics Leadership Ontario, Rehabilitative Care Alliance, Seniors Care Network, and system partners for their insights and support in shaping a framework to guide care for those living with and at risk of frailty. Finally, thank you for taking the time to learn about this work and for everything you do to advance care for this population across our system. Please feel free to reach out with any questions or additional feedback regarding the framework. Thank you.